good evening. I'm Dr. Rupal and I'm a pediatrician, and today I'm going to talk about growth monitoring in breastfed babies. Generally, what we do is as a pediatrician, when the child comes to our clinic, we monitor their growth using WHO growth chart. Now, WHO growth chart looks like this. If you look at this one, this is weight for age, and there is another growth chart. It's called weight length for age. So this is the length for age, and this is the weight for age growth chart. This is for a girl, pink in color. This is for boys. So today, let's start with the weight for age for boys children. WHO growth chart is used in each and every country up to 5 years of age. So what they found is children from 6 different continents. What they did, they selected a few children who all were on breastfeeding. They had good health, they had immunization, and they had a good sanitation. When they put all these children over longitudinally, they put all the children on a growth chart. All of them grew at the same rate. So, and one of the country which they took was India. So in India, till up to 5 years of age, we use this growth chart. Now, if you look at on the x-axis, this is a child's age. So this is 1 year, 2 years, 3 years, 4 years, and 5 years. And on y-axis, you have the weight of the child. So 1, 2, 3, 4, 5, you can see the weight. And if you look at the chart, you can see about 5 lines. So 5 lines is basically your middle line. Then you have the orange line on either side of your middle line. And then you have a red line. So if you look at the number over here, the middle line, it's 50th percentile. 50th percentile means 50% of children are above this line, 50% of children are below this line. So about 50% of children, they fall on this particular line. Okay, if you look at the one below it, it says 15th percentile. 15th percentile means 15% of children in the world, they are on this line or below this line. Okay, and the last line is your 3rd percentile. That means only 3% of children are on this line or below this line. But if you look at India data, almost 38 to 40% children are below this last line. Okay, so we have to be very careful, and these children are basically underweight children. So we want to make sure that children are growing at least average, or just around average. 50% children should be on this line. Okay, now if you look at the top line is 97 percentile. 97 percentile means 97% children are below this line, and only 3% children fall above this. Okay, and same thing for 85th percentile. Almost 85% children should be below this line, and 15% children above this line. So this is the growth tracking. Now here, if you look at the birth weight, and if you look at the middle line, which is your green line, so the green line, which is a 50th percentile, the average birth weight of a boy child is about 3.3 kg. So that is for world average, 3.3 kg. And average birth weight in India is 2.7. So Indian children are already born small. Okay, but we have some growth catch up in first year or so. So if you can basically kind of work, have proper breastfeeding, effective breastfeeding with good latch, they grow at a pretty good rate. Now if you look at the growth chart, if you look at in first 1 year of age, see how, in fact, first 1 year of age, look at how child is growing, pretty kind of fast growth, and then they slow down, right? If you look at the trajectory, first 1 year is pretty fast growth, right? So mainly by 6 months of age, your 6 months old boy child should be around 8 kg. Okay, and for a girl child, they should be about 7.5 kg at around 6 months of age. Okay, so this is how we track. And if child is not kind of growing along the track, or if child is falling down, then it's important that we talk to a specialist who is who works with growth monitoring or growth, pediatrician basically, or a nutritionist, who knows proper latching, proper food, what kind of food to give. So this is your growth chart for weight for age for a boy. Now here, this is I'm going to talk about a length chart. So if you look at the length, it's pretty much the same thing. This is the month over here on X, and Y you have your length. Okay, same basically classification. Middle line is your 50th percentile. Okay, and you have your 85th percentile, 97th percentile. So taller your girl is, basically they'll be much higher up, and shorter they are, so they'll be basically lower than, your 85th percentile, 3rd percentile. So now what we need to do is basically, as child grows, this you can see about 12 squares over here. So these are your month 1, 2, 3. So you can track them. You can download this growth charts from WHO website. This is a percentile growth chart. So you want to go with percentile and not Z score. Okay, and you can track it. Now if you have access to a smartphone, there is a very good app. It's called Child Growth Tracker, and you can put in child's date of birth, weight, your length. It will track it, basically automatically it will track on growth chart, WHO growth chart, and you can follow up, and you can always ask question to Jayashree madam, or you can ask question to me, and we will be more than happy to help you. Thank you.